Spending more time online in the coming months, and parents are concerned this could take a toll on their kids' mental health. Eyewitness News reporter Elizabeth Christian spoke with a behavioral health specialist about the different types of screen time and what parents can do to help.
In this era where digital technology is so important, it is also important to note that there are two different types that your child is engaged in: active and passive.
Not all screen time is created equal.
Electronic devices are so important, even for children, during the coronavirus pandemic, where keeping a distance is key.
Is it more passive use of social media, or is it more active engagement with their friends?
Jason Gifford with Kern Behavioral Health and Recovery Services says the two types of screen time use will determine how it is affecting your child.
We want them to interact using that screen time for educational purposes, but we don't want it to trade off with that physical health time as well.
The key is to keep it active with educational use of technology, with socializing with friends, and with physical activities. Gifford says it is also important for parents to try and set the example for reasonable amounts of screen time and exercise.
You kind of want to teach them how to do it and be a good role model for them.
The more passive use of digital technology is social media apps your child might be scrolling through.
It's linked to having more depression, more anxiety in children.
It is recommended to limit passive screen time and keep track of what content your child is looking at.
And finally, one thing that's really helpful is just use the technology along with your kids.
In Bakersfield, Elizabeth Christian, Eyewitness News.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.